Test, test. Hey, Billy.
We have a few members who are on their way and will be joining us shortly. With that, we're going to go ahead and commence today's meeting with the roll call. Mr. Allen?
Here.
Dr. Freeman? Representative Fugit?
Here.
Mr. Ingram?
Here.
Ms. Kelly?
Here.
Ms. Purdy?
Here.
Ms. Raines?
Here.
Dr. Roop?
Here.
And with that, we have a quorum, and we'll go ahead and get started moving forward with today. First order of business will be the adoption of the agenda. May I have a motion to approve the agenda?
So moved.
Motion has been made. May I have a second?
Second.
Motion has been made and seconded. All in favor, say aye.
Aye.
Any opposed? The motion passes. Next order of business is the business meeting schedule for the commission. I'd like to take this opportunity to announce that we're doing something which the commission members have asked about and a number of community members have talked about. We're actually going to be conducting some of our meetings outside of Frankfurt. So our next scheduled business meeting, which is scheduled for July 8th of this year, is going to be held at 1 p.m. at the UK Center of Excellence in Rural Health in Hazard, Kentucky. On September 9th at 1 p.m., the next meeting will be held at the Green River Area Development District in Owensboro. And then the November meeting will be back here November 4th. We'll be back at the Capitol Annex here in Frankfurt. So again, that's a change, but what the commission has shown that it wants to be able to reach out and hit some of the other communities. And so this is an opportunity for us to be able to get out in the Commonwealth and extend past the footprint, past Frankfurt. So thank you very much for everybody for that. Next order of business is going to be the minutes. So hopefully you've all had an opportunity to review the last month's meeting minutes. And may I have a motion to approve the minutes?
I make that motion.
I have a motion. May I have a second? Second. Motion and second is made. Any discussion? All in favor?
Aye.
Aye.
Any opposed? The motion passes. Next up are executive director updates. The first portion of my time I'm going to yield to Mr. Allen. We want to have an update on the Youth Prevention Advisory Group, which is help supporting the Attorney General's initiative. And for that, I'm going to turn to Mr. Allen for an update.
Thank you, sir. Just an update to the commission and those of interest. We met last week, May the 7th, with some educators, primarily some representatives from the Better Without It campaign. And I was really impressed. You know, oftentimes in the prevention aspect of what we do, one of the critiques is there's really no way to determine how well we're doing. Well, the thing that impresses me with Better Without It campaign is, you know, obviously they target a certain demographic, the Gen Z folks, and they primarily focus through Instagram, but they monitor the engagements. And I was really impressed with that. They're able to report back to us the number of people that are engaging with their videos, the number of people that are watching the various media. I have very little involvement on social media, so this is certainly outside my demographic, but I'm really impressed with their target group and the way they go about presenting the Better Without It and ultimately the prevention aspect of it. One of the things that they did that really impressed me is they worked with University of Kentucky, University of Louisville, and Western Kentucky University with getting some athletes to come out and speak about being drug-free. And Trent Noah and Cassidy Rowe from UK specifically, I watched their video, watched the young man from U of L, and they share the same prevention message, and it's primarily targeted for prevention of first-time use. And so I was really impressed with what they're doing. I think the money that this commission spends toward that endeavor is a worthwhile endeavor. The director probably picked the least intellectual person of this group to represent that committee, but I'm honored to sit on that committee and be a small part of it. But I think we're going to meet quarterly just to kind of update with Better Without It. And that's not the only show in town. We're certainly looking at other ways to promote the Attorney General's Youth Prevention Advisory Group. But that's the update. I hope feel free to jump in, anything that I missed, but I'm certainly glad to be a small part of that group.
Thank you, and clearly you're underselling yourself, as we all know. Any question from any of the other commission members? All right. Seeing none, we'll move on to the next update. We're very excited that today is actually our website is being updated, and a new website for the commission is being launched, and that is actually turned on today. So there will be a little bit of time as it gets switched, so when you look to the account that you've gone to in the past that you find it, but actually through a lot of work, and I want to make sure to support and thank the University of Kentucky and those folks who worked on this project also, as well, and the entire staff who've been diligently working to make this happen. I think that you all will find our information more accessible, and also the ability to look at things outside of just the work we're doing is something which is going to be coming down the road also. So we want to make sure to take the day to highlight that and thank everybody who spent a lot of time working on that. The entire team and entire staff get a lot of credit for all the hours they've put into making sure that this has happened. I get the opportunity to mention it all to you, but the real work is done by the folks sitting to my right to make sure this happens. So thank you to all of you for that. And in talking about our staff, I also want to highlight a newer addition to our staff. Haley Mattingly has joined us as an executive advisor for grant management. So sitting up at the front row is Haley is now with us. Hallie is now with us, and appreciate and are excited about her joining us and bringing from her background to the work that she's going to be doing with us. And then sitting next to her is Anderson Jones. As many of you may know, we had 3 interns last year. Anderson is our new arrival for this year, and we'll have 2 others joining him shortly. And so we want to make sure that we always highlight, if you see who's somebody new in the room that's associated with the staff, you know who it is. And we want to thank them both for joining us. With that, I'm going to go ahead and move into the new business portion of this. We've got a number of motions which are going to need to come before the commission and will require a vote potentially. So for that description, I'm going to ask Deputy Director Halliday to give the details on that.
Thank you. So as you all know, as we were putting in processes for the 2023 round of grants, there were several organizations that had money that extended beyond their contracts. We have 3 additional ones. These should be the last ones from the 2023 cycle. Each of these organizations has presented us with a plan for how they will spend out the money. They just need until the end of December of this calendar year to do so. It's all in alignment with the way that the grant applications came into the commission and were originally approved. It's just taken longer for various reasons. The 3 organizations are KYOAAC Behavioral Healthcare, Northern Kentucky Area Development District, which just has a very small amount for transportation issues left, and Oxford House had some additional money. The KVC and Oxford House amounts are in the $80,000 to $100,000 range left, but they have a very good plan for how to spend it through the end of the calendar year. So as we've done before, we need to bring those to you since it will take a reissue of a no-cost contract to get approval. We can do that either through motions on each individual one, or if there's no objections to any of them or other questions, we could do it as one motion. But any questions related to that?
How much is the Oxford House remaining amount?
It's about $100,000, I believe, that they will have. They still have until the end of June to keep spending. So based on their estimates, they're thinking around the 100,000 range.
I'd make a motion that we extend those grant periods until the end of December 2025 of the 3 grantees that Jesse described.
Can I get a second to that motion?
Second.
Motion carried. All in favor say aye.
Aye.
Any opposed? All right, with that, the motion passes. Thank you, Jesse. Appreciate that, and thank you, everybody. We're going to go ahead and move into the next section of today's meeting. This will be the public comments on priority funding. This month, we're focusing on our public comments on an opportunity on hearing about what people would like the commission to consider when setting its priorities for funding in the next fiscal year. I do ask, please avoid talking about specific applications Focus instead on general areas of support you'd like to see the Commission emphasize in a future grant application opportunity. We have a large number of people clearly here who have signed up to speak in advance. So I will call individuals to the table in front to speak, and we'll do that based on the order in which people signed up. I'm sorry we can't take other individuals who've come in, but as you can tell, we will be extending this for a 3 to 5 minute opportunity for each individual or organization to come speak to make sure we can get to everybody in a timely fashion. We don't want to play anybody off with the Oscar music. So if when you get to 5 minutes, you may see a waiver, and that is the sign to say please wrap it up, so we can make sure that we can go through and include everybody. There will be an opportunity. I will ask if any commission members have any questions of anybody, so that they do have that opportunity. But with that, we will go ahead and move forward. I do also want to make sure to note that people can still submit written comments, and you can do that by sending an email to KYOAAC@ky.gov. All comments about priority should be received by June 20th in order to be considered at the July meeting. So again, if you don't get things through here, there is the opportunity still to submit that in the writing, and that will make it to the full commission before setting any priorities. That being said, we'll go ahead and get started. And the first person we'd welcome to the podium, to the table, is Director Maddie Eubanks from Why Now Mentoring. I thought I saw Maddie in there. Yeah. Thank you very much for joining us. Feel free to sit down. Yeah, please come, because we will need you. And I will say, for everybody who comes up, when you please pull the microphone close to you, and there's also a button in front that says push, and you'll see a green light come on, and that will make sure that we're able to hear you and it's able to be recorded, and those who are hearing it outside are able to pick up. So thank you very much.
All right.
Thank you.
Last October, I was going through my grandmother's belongings, and tucked away in her Bible was a letter from my uncle to my grandfather. What I am about to read is an excerpt from my uncle's letter dated January 15th, 1970, when he was in a juvenile drug rehabilitation center for his heroin addiction. If I could explain how bad I feel being in here, I would. I know you and Mom have tried as hard as you could to straighten me out. I guess I was just a natural, stupid person and was too wild to help myself, so I won't blame anyone else except for myself. My uncle suffered from substance use disorder his entire life, leading up to his death in October 2010. What was not addressed or even spoken about back then is his mental health and the undiagnosed, untreated mental illnesses he had. So he coped by using drugs and alcohol. In 1988, my uncle walked up to a hospital pleading for help because he was feeling suicidal. No one listened. He shot himself in front of the doors of the hospital and survived. Once again, rather than his mental health being addressed, he was criminalized and charged with assault and battery and disorderly conduct for his attempt on his own life. This only led to further addiction and ultimately his death. I met my daughter's father, Terrence, in 2002. He had a lifetime of trauma, coming from a broken home, absent father, a drug-addicted mother, and family members. He was also the oldest sibling and felt the pressure of having to provide where his mother could not. I remember the first time Terrence took an Oxycontin pill, somewhere in the mid-2000s. It was the first that would eventually be his last. The effects of this showed instantly. His addiction snowballed over the next several years. In 2012, he was granted drug court. The problem was only the substance use disorder was addressed, not the mental health issues or the traumas that caused it. While in the drug court program, I wrote the judge a letter pleading to send Terrence to an inpatient rehabilitation center that could address his needs on a deeper level. The plea was taken into consideration but was ultimately ignored. Terrence was eventually sent to prison and was released in December of 2018. He died of a fentanyl overdose February 10th, 2019, 8 days after his 36th birthday, 2 months after being released from prison after being sober for almost 4 years. 2 years ago, 2 years ago, two brothers who were participants in my program had taken pills that were purchased off of the street. One brother overdosed in front of the other. Luckily, the brother knew to call 911 and EMS was able to administer naloxone in time. The brother called me frantically asking me to take him to the hospital to see his brother. This youth was high, could not process what was happening, and it was clear he had been on a binge. Our program was able to give this youth space to shower, eat, and sleep, and it was an eye-opening moment where we knew we had to start educating our youth on fentanyl and drug use. These stories are often repeated far too often and unfortunately have been experienced by many. I have lived experience in the drug world my whole life. My father, uncle, brother, daughter's father, and a few friends. In middle school and high school, I too used drug and alcohol as a way to cope with my traumas. What I knew then is that the devastation addiction caused not only to the addict, but to the people that love them the most, but also how it helped people feel numb from their pain. Years later, I still have the lived experience, but I am now educated on what substance use disorder is, its effects, but most importantly, the underlying issues like mental health and trauma and how they are left unaddressed. I found my purpose in helping our youth by showing them love and compassion and also teaching them that they are worthy of both of these, but also educating them on how to cope with some of the things that they have gone through in a healthy manner and to intentionally practice these coping skills. As I've shared, addiction is not new. Programs such as Why Now and many of the others amongst us today have the power to transform risk into resilience by investing in our youth before they become statistics. You have the power and the opportunity to provide funding for additional services for our youth to address their mental health issues and needs, their traumas, and removing barriers for our youth.
Thank you very much. Any questions from anybody? Thank you very much. Next up, from the Kentucky Center for Grieving Children and Families, Director Salisbury.
Is it on? There we go. Good afternoon. Thank you for the opportunity to speak. I'm Leela Salisbury, the founder and director of the Kentucky Center for Grieving Children and Families. We provide ongoing peer-based grief support to children and teens who've lost a significant person, often due to substance use. In Kentucky, 1 in 9 children, or a staggering 11% of our youth, will experience the death of a parent or sibling by the age of 18. When we factor in deaths of grandparents, other caregivers, relatives, or peers, especially those deaths caused by substance use, which accounts for approximately 25% of our parental losses in Kentucky, these numbers grow significantly. These are the tens of thousands of children in Kentucky living with grief shaped by trauma, instability, and stigma. And yet grief remains largely invisible in our child-serving systems. We know from research that children who lose a caregiver, especially to a substance-related cause, are 2 to 3 times more likely to experience significant mental health challenges such as anxiety, depression, and PTSD. When grief is complicated by trauma and stigma, as in the case of overdose deaths, the emotional toll intensifies. The link between bereavement and SUD is direct and urgent. Bereaved youth are more likely to begin using substances themselves, sometimes as early as middle school. Research shows that unresolved grief can lead to early substance initiation and increased risk of developing substance use disorders later in life. Just this morning, I was at one of our public high schools in Lexington meeting with a school counselor there about a program that we wanted to do together. And he told me about a young woman whose brother had been murdered 4 years ago. And he said now, 4 years later, this young woman, a high school student, is struggling with substance abuse. And he said that connection was pretty clear to him. We also see grief showing up in behaviors. Grieving youth are more likely to disengage from school, act out, become chronically truant. These behaviors are misunderstood and punished rather than addressed with empathy. And this kind of school disengagement and discipline are key gateways to later juvenile justice involvement, which is also often tied up with substance use. Grief is particularly challenging for young people because they are still developmentally self-focused and hardwired to believe that they have somehow caused the death of their person. In one of our groups where all the participants had mothers who had died from overdose, one middle school young woman said, "I knew my mom's friends were bad news, that I didn't stop her from going out that night, and it is my fault she is dead." This sentence is heartbreaking and also very much the norm for bereaved children. When they realize they're not alone, that they finally understand the death is not their fault, when their grief is acknowledged and supported, they experience a shift. We see children and teens beginning to understand their emotions and responses, better connect with peers, and find healthier ways to cope. This is not just healing, it is also highly targeted prevention. Peer-based support models have been proven to support emotional regulation, increase school engagement, and build resilience, protective factors that dramatically reduce the risk of future substance use. And yet programs dedicated to the long-term grief support for children and young people remain few and far between, especially in rural counties. Why is this? Such support services are not billable through insurance. Without dedicated public investment, grief support remains a patchwork, accessible to some but unavailable to many, especially in those areas where there is the greatest need. So I'm here today to ask the Commission to take 2 key steps. 1, recognize grief support for young people as a foundational part of Kentucky's opioid abatement strategy. And 2, to provide sustained annual investment to expand access to non-clinical, peer-based grief support services across the state. This is prevention, this is mental health treatment, this is workforce development, and above all, this is justice for these children who are often left carrying the heaviest emotional burdens with the fewest available supports. The return on this investment is long-term and measurable. Resourced, resilient children are more likely to become healthy, engaged adults. Unaddressed grief, however, often compounds into generational trauma and continues cycles of substance use. The sustained focus and investment from Kentucky's settlement funds will help our bereaved children grow into healthier and more resilient adults who are better prepared to thrive, contribute, and lead. I appreciate your time and for your ongoing commitment to efforts supporting prevention and long-term healing for our children with loss across the Commonwealth. Thank you.
Thank you very much. Any questions? Thank you. Yes.
I just want to thank Leela for all that she does. She started the Kentucky Center for Grieving Children and has built it from the ground up with very few resources. And Leela, I just want to say thank you because I have seen your work. And from someone who lost their father at a young age, I know the impact this can have. So thank you.
Thank you, Karen. I appreciate it.
Thank you. Next up from Ramey East Step, Kelly McCormick. Thank you. You'll need to put the...
Oh, there it is. Okay. Sorry, it looked green from here. First, just want to say thank you for the opportunity to talk and the opportunity to be a grantee for these funds. We've been able to touch so many lives and help people towards recovery in all the ways that our grant has allowed. What I'm here to speak about today is to increase access to services for underinsured, overinsured, because that's a thing, and non-insured individuals. So there's some great voucher programs in the state, some assistance opportunities, the core vouchers, the Unite vouchers. These things are wonderful. The problem is there's other huge gaps of treatment that people aren't able to access even through those types of services. So think about somebody's in recovery housing. They're using a core Unite voucher to be there, but they need case management. They need targeted case management. They need medications. They need, maybe peer support, individual therapy, all kinds of different services to help them towards recovery and to be able to live on their own. We don't want everybody to just be in recovery housing or residential and not have access to those things. So there's a huge population of those that we work with day in and day out that don't have access to these services. And we're doing them a disservice by once those vouchers run out, because they're time limited, they're number limited, their diagnosis limited, their location limited. If those run out and you can't be there anymore, and you don't have the help to find housing, to maybe get a Medicaid, to get on Medicaid, to access the services you need, we're doing them a disservice, and we're just helping them back into the cycle. So wanted to just speak about that gap of services and ask you all to continue to help fill that gap with some of treatment vouchers, whatever you want to call it, treatment access vouchers.
Thank you.
Yeah, I won't take up a lot of time.
No, that was quick. Any questions or comments?
A quick question from
Yes.
me. Can you explain a little bit more where the gaps are? You say gaps.
Yeah, so the gaps is just not having access to those services. So if I don't have Medicaid, right, a provider isn't going to provide me case management for free. I don't have access to see a medication management provider, maybe a MAT provider, and then also, you know, I might not have funding to get those medications that I need to be on to help me in sustained recovery. So we need funds, treatment access funds, to pay for those services for those people until they can fund them on their own. Until they may get on Medicaid that can fund them. But there's a gap in that time period where they may or may not be able to pay for those services or find a provider. Providers can't do those services for free. There's lots of providers that do them. You guys work with them every day. But we as a provider cannot just have somebody out there doing case management without any type of funding or reimbursement for that service. So that's where that gap is people aren't able to access those vital services like case management, med management, peer support, even therapy, without some kind of funding to help them do that. Does that answer?
That helps. Thank
Okay.
you.
Yes.
Okay. Thank you very much. Next, from Franklin County ASAP, Mr. Charles Kendall.
First of all, yes, I'm Charlie Kendall with Franklin County ASAP. I'm also on the state ASAP board and in constant touch with most of the ASAPs in central Kentucky. I'll be brief. First, thank you for the opportunity to hear what we are facing and what we see as issues for the future. Thank you also for your flexibility over this last contracting cycle. And for loosening up some of the previous very impossible requirements. I would urge you to continue with your symposium as a showcase for grantees. That was hugely successful, and we need an opportunity as grantees to see and understand what works elsewhere. And in that capacity, we need to figure out some way that we might create scalable projects, and I would encourage you to think through that process. What works in one county could very easily be scaled to perhaps another county if we could figure out how to make connections, how to encourage funding, how to encourage those dialogues. So I would encourage you to use this symposium and your showcasing to perhaps figure out how we might be able to scale some of these projects to other communities. I know in Franklin County we have a tremendous capacity to scale and to steal other good, really good ideas. Continue your focus on prevention as well as recovery. We are all about prevention in Franklin County, and not only as a means of reducing or eliminating the onset of opioid use in the community, but also in preventing relapses through harm reduction. I think we all need to think about, as the overdose deaths have now come down, we know, many of us, how that has been possible. We know what works, but we are concerned that we cannot take our foot off the gas, obviously. But we need to also begin looking at trends that need our attention to sustain not only the continued drop, but also to support long-term recovery. And then I'd like you to consider multi-year contracts, multi-year awards. It is very difficult to develop a plan and go through the submittal process and not allow for changes. And you've been very flexible in regard to letting us make contract modifications and extensions and those sorts of things. But many of the projects that we're working on do not have 1-year benchmarks. They require several years to develop momentum and to accomplish the significant cultural and ecosystem changes that we're all looking for. And then finally, Franklin County ASAP is very proud to be part of 2 work groups, one for the county and one for the city, on how they will be spending their opioid abatement funds. That's not true in many counties. And at some point, I think we're going to have to look closely at how all of the opioid funds are being spent in this state, so that we can get a much better perspective on what are the projects that work across the state. Thank you.
Thank you. Any questions?
I have a question,
Yep.
Mr. Chairman.
Yep.
Thank you, sir, for being here today. You stated earlier in your statement that we know what works. Would you tell us what you believe works?
Well, I hope you're going to hear from a lot of the people in this room as to what works. Naloxone works. And we've got to continue to make that not just available, but unavoidable. What also works is the attention when people are ready for recovery, ready for treatment, that it is there. And we have greased the skids. I've sat with Van Ingram many times on the ASAP board, and we've got a lot of treatment beds, as you all very, very well know. But we've raised the bar with regard to it is now available. The life that you have been living, you don't need to continue living. So it's changing the mindset within the communities that there is more hope. There are more people in recovery that are speaking out. There are more people embracing the life that they have found after their addiction. Those are the things that work.
Well, I'm going to compliment you. I believe that naloxone does work. When I was a prosecutor, I founded a group in Garrett County, Garrett Leadership Against Drugs, and one of the first things we did was get several cases of naloxone. And it worked so well that when we ran out, and when we ran out of money, we didn't run out of naloxone. So several of us went together to purchase it privately and offer it to our EMS services. Hopefully it saves some lives, but I think you're on the right track here. Rescuing these folks from the grip of drugs is not easy, and the phrase that we encountered at home was, this is a life of 10,000 second chances. And it also meant that no recovery comes without relapse, as
Right.
we found out
Yeah.
as well. And so I applaud you for what you're doing, and appreciate the degree of what you've absorbed, and you're telling us in just bits and pieces what you've learned, but how it's affecting how you administer a program and then hopefully redeem lives.
Right.
And I appreciate what you've said.
All right. Thank you, sir.
Thank you.
Thank you. Next up, from River Valley Behavioral Health Center, Director Arnold.
Hi, good afternoon. Thank you for the opportunity to speak with you today. Like others, I'm here to address the matter that touches every community in our Commonwealth, the ongoing opioid epidemic crisis. While we've made great strides in treatment and recovery, I want to talk today about something that's just as critical, which is prevention. Because if we want to truly turn the tide, we must stop addiction before it starts. My name is Brooke Arnold, and I get to serve as the director of the Regional Prevention Center for River Valley Behavioral Health, headquartered in Owensboro, Kentucky, and we cover the Green River District area. I also serve on the Kentucky Certification Board for Prevention Professionals, and I'm the co-vice president for the Owensboro Regional Suicide Prevention Coalition. I've worked in the field of substance misuse for 20 years, with the last 18 of those years being in prevention. We all know that Kentucky has been hit especially hard by the opioid epidemic. And according to the recently released Kentucky Office of Drug Control Policy, while overall overdose deaths decreased by 30%, over 1,400 Kentuckians lost their lives to drug overdoses in 2024. Those are our neighbors, our coworkers, our children. So yes, let's celebrate the decrease, but we cannot take our foot off the gas pedal, just like Charlie said. And while treatment most certainly saves lives, the pipeline of addiction continues. Because one of the questions we must ask ourselves is, of the 1,400 individuals that we lost last year, How many had children who now know a world without their parent? These children are often the very first impacted by drug misuse, yet they are the last identified and to receive services. We can't afford to only treat the wound. We must stop the bleeding at its source. Primary prevention targets the root causes of substance misuse. That means investing in community-based education, youth mentorship programs, mental health support in schools, and trauma-informed care before a young person ever touches a pill or a syringe. Evidence shows that for every dollar invested in prevention, we save up to $18 in healthcare, law enforcement, and lost productivity. That's not just compassion, but that's really smart economics. And when kids are taught life skills, when parents and schools have the tools to intervene early, and when communities foster healthy coping mechanisms, we build resilience. We protect our future workforce, and we strengthen Kentucky. Without investing in prevention, we are stuck in a reactive cycle. Treatment centers get overwhelmed, emergency rooms fill up, families are devastated, and the next generation continues to watch it all happen. Primary prevention is not a luxury, it's an absolute necessity. And right now, prevention programs across the state are underfunded, understaffed, and overburdened. Yet we have the tools, we have the knowledge, and we have the power of the strategic prevention framework. What we need is the will and the resources to scale them. Kentucky's children are 100% of our future. Let's ensure that our youth have access to after-school programs, mental health services, and education that empowers and not just warns about the dangers of substance misuse. Supporting primary prevention before we even need harm reduction or addiction services would be a testament of our priorities of stopping this epidemic before it kills one more loved one from our Kentucky families. Let's invest in upstream solutions that change trajectories, because a child who never starts using is a life saved, not later, but right now. So let's lead Kentucky towards a future where prevention is not just a talking point, but a pillar of our public health strategy. Instead of focusing on the leading causes of death, let's focus on the leading causes of life, such as positive connections and healthy relationships, trusted adults and mentors for children and adolescents. Because the evidence is clear that youth having just one trusted adult in their life is the #1 protective factor in combating substance misuse. I thank you for your time, and I leave you with this one question to consider when focusing on the next round of funding, is what part would this commission like to play in changing the trajectory of Kentucky's drug-endangered children? Thank you very much.
Thank you. Any questions?
Thank you.
Thank you so much. Next up from Operation Parent, Director Oliver. Okay, one more time, Director Oliver from Operation Parent. Okay, the next up from the Kentucky Harm Reduction Coalition, Odell Hager.
Hello, can you hear me? All right. Good afternoon, and thank you for allowing me to speak today. My name is Odell Hader, and I'm here representing the Kentucky Harm Reduction Coalition. I come to you today as someone on the ground witnessing firsthand the impact and potential of harm reduction. 1, acknowledging progress, naming the problem. We've seen a decline in overdose fatalities in Kentucky. That's progress. But let's be honest about what drove that decline. Harm reduction efforts. Naloxone distribution, syringe service programs, safe outreach, and trusted community relationships. That progress didn't happen in isolation. It came from intention and investment. And yet, in the midst of that progress, we see signs that this commission is not prioritizing harm reduction as prevention. That's a fundamental misunderstanding of what prevention means. Harm reduction is prevention. How is preventing death not prevention? How is connecting someone to treatment not prevention? How is building trust through consistent, culturally competent outreach not preventing future harm? Since the Harm Reduction Coalition's inception, we prevented countless deaths, connected hundreds to care, and changed the trajectory of entire families. That is prevention, and it's working. The problem was short-term thinking. 18-month pilot projects don't fix a 50-year-old crisis. This crisis demands a long-term sustained investment. Harm reduction organizations should not have to operate under the constant threat of defunding. Imagine what we could do with 2 to 5 year funding commitments. Imagine the lives we could save if outreach specialists had the support to follow people into recovery, not just make first contact. Concrete visions and solutions. Medicaid is in crisis, law enforcement is overburdened, and communities are overwhelmed. Settlement dollars are not just reparations, they're opportunities. What do these dollars help scale successful models like On Point in New York City, where police respond to violence while outreach teams handle care? That isn't a fantasy, it's a proven solution. Call to action and accountability questions. We are seeing increasing rates of substance use among elderly Black Kentuckians. The number for youth experimentations are not slowing. We can stop now, not when we finally see a path that works. We can't stop now, sorry. So I asked you, if not this, then what? What exactly are you looking for to correct this crisis, and how will you know it will work? If the data is what drives decision making, then why are organizations like Kentucky Harm Reduction Coalition still fighting to justify their existing? In closing, harm reduction is working. We've proven that what we need now is not another pilot. We need protection, prioritization, and long-term partnership. When we heard the 30% overdose death decrease, we were thrilled for this outcome. But the only acknowledgement truly that we really heard was treatment and recovery. As a person in long-term recovery who also works on the treatment side of things, as well as boots on the ground, and who was once saved by the efforts of harm reduction, the first steps before treatment and recovery is harm reduction. This commission has the power to invest in what saves lives. Thank you.
Thank you. Any questions or comments? Thank you very much, sir. Next up, Choose Well Communities, and I understand that Director Yost will be introducing Lindsay Wood.
Hey, good afternoon. My name is Leanne Yost. I am the Director of Choose Well Communities in Louisville, Kentucky. We are grateful recipients of funding this current year. Our organization deals with families in recovery with children under 5. The reason we pick children under 5 is because of their brain development. And it's also ACEs prevention if you are familiar with adverse childhood events. Your thoughtful priority setting process last month resulted in nearly $20 million in funding. It's really transformed lives. Some that I witness, and I'm boots on the ground. One of the things that I'm kind of surprised hasn't come up today is the critical gap that we continue to face is the lack of safe, affordable housing options, specifically designated for single parents in recovery and their young children. Some of you may know that Louisville Metro Housing is going through a shift, and we had at least 40 vouchers left to house our families, and currently they were taken away, and we have 18 families in limbo. Without suitable housing, single parents often face impossible choices that jeopardize both their recovery and their family stability, and that is a direct ACEs. As you set priorities for the next round of funding, please continue to invest in recovery support services, specialized housing programs, comprehensive parenting education. A lot of parents don't know how to parent because they didn't have parents themselves that were active in parenting. Workforce development initiative. Harm reduction does work. Gap funding is desperately needed. Not long ago, there was a young mother who relapsed waiting to get into Choose Well Communities, and her baby unfortunately passed away. Gap funding would really help situations of that nature. And your continued support will ensure that individual successes result in community uplifting. They become enduring legacies, ultimately fostering healthier, safer, stronger communities across the state. Multi-year contracts is a great idea, and trauma is the gateway drug. Thank you. I'm Leanne from Choose Well Communities.
Thank you. Any questions or comments? We're good. Thank you very much. Next up, from Coordinated Healthcare Innovations, Daniel Malloy.
Thank you much. Appreciate you allowing us to be here with you guys. So this is truly an honor and to be in the room with these folks behind me. Can you sense the passion? I mean, it's powerful. My name is Dan Malloy. I have had the privilege to be a partner with Kentucky, whether it be the Cabinet of Health or Kentucky Public Health or communities since 2019. Communities such as Perry County, Hardin County, Letcher County, Jefferson County, Boyd County. I could go on and on because the communities are just powerful work. But as that partner, we've seen the opportunity to build community collaboration through the development of quick response teams, a collaborative community response, or the situation tables. The situation table allows for communities to address acutely elevated risk in a number of risk factors, to include substance use, but also mental health, youth, parents, those kind of things. So the reality is, I just want to say thank you, number one, for allowing a voice from the communities to be present with you and share the things that are happening on the ground, because not everyone does that. So to take in input from the field is really, really important as you move into the next funding year, the next opportunities for these communities. And you're going to hear me echo some of what Charlie had to say. So we didn't meet beforehand. We didn't talk through what we were going to talk about. But I think the reason that I'm here is I want to talk about that innovation, that best practice, that recognition within the communities we're doing good work. People's lives are being impacted. Communities are working together, and it looks different in Kentucky than it might look in other states, and that's okay. Because every community, while you have 120 counties, every community is its own community. So is it law enforcement? Is it fire and EMS? Is it behavioral health? Is it public health? Is it peers? The communities are allowed to make those decisions, and I think that's the powerful part about what's happening here. But to the point that I'll piggyback off of Charlie is that 12-month funding cycle. We appreciate the opportunity to demonstrate success through innovative practices. But that 12-month funding cycle comes with challenges, especially when you talk about people and adding personnel to teams and staff, finding the people, getting them trained, helping them understand the culture associated with the work we do is not something that is quick. It's not something that's easy. And then as you move through, if you start to feel comfortable, next thing you know, that it's time for that next application. It's time for that next funding cycle. So just wanted to talk about that. And then my real request is, when we learned we were going to have an opportunity to speak with you guys, the teams in Kentucky meet every month, the first Thursday of every month at 1 o'clock, and we talk about what's happening, what are teams doing, what are they experiencing. And we said, hey, we're coming. They've offered us a chance to speak to them. What would you like to know? What would you like them to know? And it came to that point. It's hard. 12 months is hard. Finding the right people, getting it done, changing the culture, whether it's through, hey, we've never done it before, and we have to educate a lot of potential community partners, or I get to grow and I get to innovate and expand the thing that I was doing really well before, but I want to take it to another level. I want to expand the capabilities. So what the group talked about is just would the commission consider taking a percentage of that funding, and I'll just throw out a number, say 25% of your annual opioid abatement funds, and say we're willing to consider programs and initiatives that are doing good work, they're demonstrating success, and funding them in a 2 or 3 year cycle, saying this is a program that we were willing to fund in that space, not changing though the understanding that year 1 might be 100%, or year 2, and year 2 is reduced by 25%, and then year 3 would be reduced by 25%. That made sense to everybody, but knowing that you could bring someone in and you could start that change, and you could see good things happening and recognize that we get 3 years to do it. And the reason that really resonated with me is we work in a lot of communities that are funded federally through this work, and a lot of the Bureau of Justice Administration grants are 3 years. And the the cycle of improvement, the growth between year 1 and year 2, and then year 2 to year 3, you're like, wow. Think back to where we were in the first year and see how the growth and confidence and network and community partners grew. So that's my ask in a simple piece. On behalf of the folks that we work with and the communities that we are partnership with, if you consider that, look at those teams, and again, not everything, but maybe maybe carve out a percentage and say, we're willing to consider. And again, it's based on your application and the work that you do, but there are programs that we'll consider that. And just keep doing the good work. Keep giving us the opportunity to serve Kentuckians. And folks, we just thank you for what you do and giving us a chance to talk. So again, thank you so much.
Thank you. Thank you. Any other questions or comments? Sir, thank you very much. Next up is from dream.org, Mr. John Bowman.
Hello. See, my microphone's on. All right. Good afternoon, Commissioners. My name is John Bowman, and I proudly serve as the Kentucky Senior Campaign Organizer for Dream.org. But more importantly, I'm a person in long-term recovery. For over 2 decades, I battled substance use, and on October 12, 2018, I took my first step toward a new life. Since then, I've worked in recovery programs, harm reduction initiatives with at-risk youth, and in policy. I've seen firsthand what lifts people up and what leaves people behind. I'm grateful for the work this commission has done and for the chance to speak today. I don't come to you with theories and models. I come to you with lived experience. I'm here to advocate for smart, impactful investments in Kentucky's opioid abatement strategy. We have one shot to do this right. Let's make it count. Investing in long-term recovery housing and peer support. Recovery doesn't happen in a vacuum. It requires stability and connection. People without housing are far more likely to relapse, and the same goes for those without a strong recovery community. We must expand certified recovery housing across Kentucky, ensure high standards of care and accountability. We also need to properly fund peer support specialists, especially in rural and underserved communities. These are people doing the hard, often thankless, life-saving work day in and day out. Let's not ask them to do it on scraps. Strengthen harm reduction and overdose prevention. Here's the plain truth. No one recovers if they're not alive. Harm reduction tools like syringe service programs, fentanyl test strips, and naloxone saves lives. These are not controversial. They're common sense. We need them in every county. Mobile harm reduction units are especially critical for reaching remote areas in Appalachia and other rural communities. These services must be expanded not just in number, but in quality and cultural competency. Expanding access to treatment in MOUD. Medication for opioid use disorder like Suboxone and methadone. It's not a crutch, it's a proven path to recovery, yet many Kentuckians still face unnecessary barriers. Lack of transportation, too few providers, stigma in medical and judicial systems. These are problems we can solve with targeted investment. Abatement funds should be used to close these gaps, not just add more treatment centers, but improve the quality and accessibility of care we already have. Let's prioritize outcomes over optics. Invest in public education. We want to turn the tide. We must get ahead of this crisis. This means education, real and honest. We need public awareness campaigns that destigmatize addiction and inform communities about recovery and harm reduction. Youth prevention. We must embed trauma-informed mental health services in our schools and support peer-led youth recovery programs. When young people understand the risk and feel supported, we give them a real chance to choose a different path. Support reentry and reduce recidivism. One of the most dangerous times for someone in recovery is right after a release from jail or prison. In the first 2 weeks after release, returning citizens are 129 times more likely to die of a fatal overdose than the general population. We must fully fund reentry services, transitional housing, substance use treatment, peer support, mentorships, job training. Let's stop this cycle where it starts and give people the tools they need to succeed on the outside. In conclusion, Kentucky has a once-in-a-generation opportunity to repair what this epidemic has broken, but we can't afford to spread these funds thinly across politically safe projects. We need focus, bold investments that prioritize quality over quantity, solutions that save lives, support recovery, and rebuild communities. I've been on both sides of this crisis, and I'm standing here today as living proof that people can and do recover. Let's make sure more Kentuckians get that same chance. Thank you for your time and your commitment to building a stronger and healthier Kentucky.
Thank you. Questions?
Question, please, Mr. Chairman. Thank you for that good statement. I'm curious, you used the term barriers to recovery, and you specifically mentioned court, and I'm a former prosecutor. I wanted to hear your thoughts on that. Why does that create a barrier?
Okay, so we can get into this. Well, it's not a barrier when someone looks like you, but it's a barrier when someone looks like me. I know people that have had the same charges as me that might be a different skin color that's going to get offered treatment a lot more than someone that looks like me. You're going to get offered prison. I never got a chance to get offered any diversion programs. I didn't get offered drug court. Always got sent to jail every time I had a drug charge. But I know people that had charges worse than me that look different than me that got sent to treatment. So we do have those barriers here, whether we want to talk about them or not, but I will talk about them. The other one is access. We have all these damn treatment beds, but we don't have access to treatment for the folks that need it. Just because someone does not have insurance does not mean that they do not need treatment, that they do not need those beds. We can have all the beds in the world, but if we can't access them, what hell good are those beds?
I have a question for you.
Yes, sir.
At least where I prosecuted, people received diversions based upon the profile of their cases, not their identity or ethnic or racial identity, based solely on their profiles. Were you experiencing this profiling that was worked against you in a court system in Kentucky?
I can say yes to that. Every charge on my record that I've ever had in my life is drug or alcohol related. None of them's violent. None of them's against anyone else. They were all me. And I took accountability for every one of them. But also I wasn't offered those opportunities.
When did these convictions occur?
Oh, from 2000 through 2018.
Okay, so for over a period of 18 years, you didn't get the treatment you thought you needed.
Oh, I didn't. No. It took an act of God to get me into recovery, sir.
Well, I think grace plays a large role in this for all of us, but let me just point out, we really weren't able to bring these kinds of tools to the fight, such as beds for rehab, until around 2018. That's when Medicaid dollars started being made available. So I'm sorry you had that experience. Where I was prosecuting, that's the first thing we did. We looked to see if people were actually willing to go to rehab instead of having their case tried. And more often than not, far more often than not, 9 times out of 10, they wanted to go to rehab. We had a few that didn't and would rather sit it out in jail than to go to rehab. I couldn't understand that because in jail they weren't getting any drugs either, although a few did. I have to admit to that. But it seems to me you've brought to light some issues that needed discussion here. And I would be very interested in getting your thoughts on this on paper. If you could stick around until we're done here, I'd be happy to also have you come by my office and talk more about your experiences. Every one of these commissioners that you're looking at today believes deeply in the mission we're on and wants to learn more. But I am hoping that you can teach something that we haven't learned, and I'm glad to listen to you.
We'd love to, and thank you all for the work that you do. I think you all have done an amazing job being transparent and really showing, where each and every dollar is went, and I really appreciate the work that you are done, and I really appreciate this opportunity to speak today, and I would love to speak with you about this. So thank you very much.
Thank you.
Thank you very much. Next up, Young People in Recovery, Director O'Brien.
Well, thank you all for giving us the opportunity to speak to you all again. I think this is probably the third or fourth time I've gotten to speak to this commission, and I know that my face is probably familiar to some of you all. But for those of you all that don't know me, I am Billy O'Brien. I'm the Kentucky Program Director for Young People in Recovery. We are a recovery support organization, so we are really there for the people when they decide to change their lives, go through treatment or not, and to support them in their recovery. And I know one of the main initiatives of this commission and of the Attorney General is prevention, and I'm going to call recovery support organizations what they are. They are prevention programs. We are here to prevent people from reoccurrence of use. We are here to prevent people from reverting to the lifestyles that they used to live. For myself, as a person in long-term recovery, my recovery really didn't take off until I found an organization like Young People in Recovery that provided me a community to go out and play glow-in-the-dark ultimate frisbee on a Saturday night and make new friends. I was the social alcoholic. So that was going to be a big void in my life, is what am I going to do? I can't go out to the bars. I can't go to weddings. I can't go to ball games. I can't do all this because it's all alcohol related. But a recovery support organization showed me a new way of life. And, organizations, whether it's Young People in Recovery or whether it's recovery community centers that connect people to services and provide the support group meetings that people need, that provide events for people to go to, that help people build a new community, that help people find jobs, help people find education. That's really, for me, where a lot of this money needs to be spent. The federal government mandates that 20% of all funding for substance use go to prevention. So we've got a lot of money being dumped in prevention. Do you all know how much is set aside for recovery support services? 0. We get no money, so we get the leftovers. And, when we get people to recovery, if we support them all the way through 1 year, the chances of them making the 5 years grows to 70%. If they get to 5 years, to get to 10 years, it goes up 80%. And if we're talking those type of numbers, think about the people that are able to give back to their community, whether it's, paying tax dollars, working jobs, providing community service. Those are the types of programs that we need to invest in to make sure that people are getting the services that they need once they decide to find recovery. And I'll go ahead and, I wasn't going to talk about this today, but a lot of people have brought it up. It's hard to operate on a 1 year budget. And for whatever reason, that seems to be the way that Kentucky does things and has done things since I've been in this industry. And, for us to start a new grant and to implement it and have the staff in place and to focus on, trying to get that grant going. And then, part of the requirements of these grants is to find sustainability. So now I've got to figure out a way to sustain this after only 1 year. If we can get multi-year investments in this, that gives us time to build our programs up and to have time to showcase the work that we are doing and to find those other opportunities to help with sustainability, whether it's foundations or fundraising efforts or whatever the case may be. It's real hard to do that within 1 year. So I would definitely like for this committee to consider thinking about multi-year grant opportunities. With that, I'll just say thank you again for having us all out here and giving us a voice. And to kind of piggyback what John just said, I really do appreciate the work that this committee has done. I've been very impressed with the way that you handle it and your priorities up to this point and the transparency that you all show. So thank you for that.
Thank you. Any questions or comments? Thank you very much, sir. Next up, from People Advocating Recovery, Melissa Algier.
Hi.
Good afternoon.
It says real big at the top of my paper, breathe. Thank you all for allowing us to come here today and use our voices. My name is Melissa Allgaier. I am the program manager at People Advocating Recovery. More importantly, I am also a person in long-term recovery. And what that means for me is for the last 7 years, I've gotten to be fully present in my life and afforded the opportunity to come and speak at a commission, which is really cool, to use my voice and experience to spread hope and show that recovery is possible. What I want to talk about today is the difference between treatment and recovery. So treatment is a chapter in the book of recovery. So treatment is a necessary initiation into recovery. But what happens after those 30 days? How do we keep people on the path of recovery and continue to support and fund those services that are so necessary to keep going on that path? Community-based recovery support services is the answer. So things like recovery community organizations, peer support, recovery housing, recovery high schools even, workforce programs, things that continue to support people after they have completed their treatment programs. We know that recovery, if someone enters treatment alone, if we only fund their treatment, that costs about $32,000. And the success rate for that is 1 in 10. So that's not a great return on investment. If we invest in treatment with those community-based recovery support services, it costs about $65,000. But the return on investment is 6 in 10. So we're investing more upfront, but we're getting a much better return on that investment because people are much more likely to continue into long-term recovery if they have those supportive services after treatment. These recovery support services decrease recidivism. Is that right? Decrease, yes. So they reduce repeat incarcerations, hospitalizations. It helps to take pressure off of some of those emergency services, pressure off the jails, pressure off the police departments. It's giving people the support that they need after that treatment to continue to live their lives in a way that gives back to their community. When people are able to sustain that long-term recovery, they do give back to the community and they become part of that prevention fabric that continues in that cycle of lifting up others to continue on that path. My recovery story doesn't have a treatment chapter, but what it does have is a bunch of different recovery support services, community-based recovery. So things like YPR, the Louisville Recovery Connection, Community Connection, that is an RCO that helped build that community of people that I needed so that I didn't feel so alone. These are things that are not typically funded through other sources. So using opioid abatement money to help fund these recovery services is a really great opportunity to help more people sustain that long-term recovery. These are cost-effective, evidence-based investments that reduce burdens and restore lives, aligning perfectly with the Commission's mission to create sustainable community-level solutions. So at the heart of this work are Kentuckians who want to rebuild their lives. They need more than just a bed for 30 days. They need housing, they need jobs, they need connection. Community-based recovery support services give them that. So let's fund what works to help more people gain and sustain long-term recovery. Also, thank you all for doing this. Thank you for having us. Thank you for the work that you're doing. I really appreciate these opportunities.
Thank you. Any questions or comments? Thank you very much.
Thank you all.
Next up from the Girl Scouts of Kentucky Wilderness Road Council, Ms. Douglas?
Oh, it looked green. I'll say the same thing that someone said earlier. It looks green from here. So thank you all so much for having us here today. So I'm going to start with some facts and then put a face to some of this data. Positive childhood experiences is a great prevention strategy for our youth directly impacted by the opioid use disorder. Children growing up in households or communities impacted by OUD often experience devastating outcomes, even if they never use drugs themselves. These bystander effects disrupt childhood development, increase trauma, and threaten long-term health and success. Emotional and mental health is impacted. Children of parents with substance use disorders are 8 times more likely to develop substance use disorders themselves. Higher rates of depression, anxiety, PTSD, and toxic stress impact brain development and emotional regulation. Family disruptions in foster care. 1 in 3 children entering foster care nationally is removed due to parental drug use, but here in the state of Kentucky, it's more than 70% of foster placements are linked to substance misuse, especially opioid use. School and developmental outcomes include youth in OUD-affected homes face increased chronic absenteeism, lower academic performance, and disengagement from enrichment and extracurricular activities. ACEs, or adverse childhood experiences, they add up. Children with 4 or more ACEs are 12 times more likely to have poor health outcomes and nearly 3 times more likely to be suspended or expelled from school. And kinship care and systemic barriers in Kentucky are grand. Families, our grand families, we're leading the nation here in the state of Kentucky, and it's a direct result of the opioid epidemic. These families, so grandparents raising their grandkids, often lack access to trauma-informed care, reliable transportation, and youth enrichment and leadership programs. So I'm urging you all to continue funding and even potentially expanding the funding for a prevention strategy focused on positive childhood experiences. We know that they build resilience, support mental well-being, create stable adult connections, and reduce risky behaviors. And I want to share one story today. Several years ago, I received a call from a mom who had recently moved back to her rural Kentucky home to care for her aging father. She brought her daughter with her and was looking for ways to help her daughter feel connected, hopeful, and supported. She told me through tears that Girl Scouts had become the space where her daughter could meet healthy people, people who smiled, laughed, and believed they had a future. She said, and quote, "Everyone around us looks gray, tired, and sunken. I just want my daughter to know what strong, confident women look like, and that's not easy to find in my community." What she was describing wasn't just sadness, it was the generational toll of opioid use disorder in her community, which often came with poverty and isolation. We gave her daughter a lifeline, a place to belong, to lead, and to see what was possible. And we see this time and time again. I recently was contacted just after this latest round of floods by a family in eastern Kentucky telling me about one of her girls that lost her home and all of her belongings just in 2021 and lost her new home this year in the flood, and how Girl Scouts and how that daughter was just needed and she didn't even call to complain about the loss of her home, but she called her troop leader to say, when can we get back to Girl Scouts? And so I just want to urge you and thank you all for the opportunity to be part of this great network that's really trying to help communities thrive. And thank you for the opportunity to share. And I just ask you to continue investing in prevention programs for our youth. Thank you.
Thank you. Any questions or comments? Thank you very much. Next up, New Hope Counseling and Recovery, Mr. Larkin.
How's everybody doing today? My name is Adam Larkin. I'm the Chief Marketing Officer for New Hope Counseling and Recovery. I'm also the CEO of Get Apparel and founder that I started in 2021. I myself am in long-term recovery, and I just wanted to say I appreciate all the work that you're doing. I know it's not easy. I know you have a huge task at hand. And I just wanted to introduce myself to those of you who I don't know. I know some of you very well. And in southeastern Kentucky, where we have 2 facilities for New Hope Counseling and Recovery, we see, the devastation that was caused by the opioid epidemic firsthand. I'm sure you can tell by my accent, I'm from New York. Because I have a good brother, I'm now in Kentucky, so I owe a lot to the great state of Kentucky. That's where I got sober myself, and that's where I have a purpose and a passion that God gave me and a fire to give back to those still struggling. Having had a spiritual awakening, it's our duty to help the next addict and alcoholic still suffering, because when I get outside of myself and I help somebody, it helps me as well, and that's what we're all trying to do. I've seen the passion that you guys share as well, and I'm just looking for new, innovative ways, aftercares, prevention, and just ways, also ideas from you. What do you want to see from us grantees? Not just what we want to see from you, but what do you want to see from us in these applications, and as well, just what can we do to work together more closely and just help those out there still struggling. So that's why I'm here, and like I said, I appreciate all the work that you're doing, and any ideas, any transparency that you have, and anything that we can do to work together, we're here.
Thank you very much. Any questions or comments?
I'll just say something. Thank you, Adam, for sharing what you stated. And I think it's something that's been brought up here repeatedly today. And in fact, Billy was the latest to mention it, was the aftercare support, keeping people connected to recovery post-treatment. And I think that any attempt that would include multiple organizations, partnerships, and a meaningful engagement to the community is going to be something that we're going to look favorably upon, because, as you and I know, that's so instrumental to a life of recovery, is having that community and that support. So that's at least one of my top recommendations.
Thank you, Dr. Roop, and thank you for all you're doing with the trait-based model recovery and that treatment modality that's helping tons of people across the state, and we appreciate you.
Thank you.
Anyone else? Thank you very much, sir. Next up, Voices of Hope, Mr. Chadwell.
Hello, everyone. We go everywhere together, so we're nice to meet everyone. I'm Jimmy Chadwell. I'm a program director with Voices of Hope. With our 5 minutes today, I wanted to talk about the idea that continuing programs that are evidence-based and working may have benefits over starting new programming. And this is because recovery support services through organizations like Voices of Hope have validated impact. This means that from the funder's perspective, that there are reduced associated risks with funding organizations that are already established. The model is already proven, the infrastructure is present, and through the support of the commission, we've been able to continue and expand our recovery support services over the last few years, so we really appreciate that. Many of the speakers before me mentioned the 30% reduction in overdose deaths that were reported recently. We think that as a recovery community and on behalf of our organization, that we have the momentum, and now's not the time to regress in what we're doing. Also, existing recovery support services and organizations that implement those, they're also more cost effective because there aren't as many startup costs associated with funding new programming. Like Voices of Hope, for instance, we have data collection systems that are up to national standards. We have the most highly trained staff in the state, and that's not just an opinion by quantity. They objectively are the most trained staff in the state as far as peer support goes. And we have the equipment. We have computers. We have cell phones, office space. We have all the things we need to successfully accomplish the mission and the priorities that the commission's willing to fund. We've also been serving the community for 10 years. Okay, so it's not like this is a pilot program or some experiment. We have tried and true proven services that continue to contribute to that 30% reduction in overdose deaths. So again, we have momentum. Now's not the time to regress. And just for a moment, if you would, imagine being a person living dangerously, using drugs daily, and then you have a moment of clarity or like one lucid moment and you want to access recovery support or seek recovery, but it's the weekend. Maybe recovery community centers aren't open because they don't have the funding. Maybe treatment's too hard to get into. Maybe they have low staff and don't have anyone available to answer the phone. Thankfully, in Central Kentucky, particularly Lexington, that's not a reality anymore because the commission decided to fund Voices of Hope for the last 3 years, and now we're open 7 days per week. So that's not even an interruption that exists anymore in Lexington. So on behalf of Voices of Hope, Lexington, and the recovery community, we're just really grateful for that. It's life-saving work, and that's because of your commitment, dedication, and willingness to help. In the same vein of thinking, though, Voices of Hope has recovery coaches stationed across the state. We serve 30 counties and partner agencies like county jails, specialty courts, treatment clinics. And these partnerships require many, many hours of collaboration, communication, and buy-in from the community to even want to be able to house our recovery coaching services to begin with. So again, in that same idea that funding proven organizations that have been here for years and they're tried and true, we've already done the heavy lifting to make these partnerships a reality, and we just need the continued support. So again, we have the momentum. We just don't want to regress in what we're doing. So thank you so much for your time. Gary, do you want to say?
I was just here for support today. I didn't know I was going to speak. My name is Gary Biggers. I'm the RCC Operations Manager at Voices of Hope. I met a lot of you all before. You all can come and visit whenever you like. I oversee the weekend program, and I've seen the significant impact that we have just being open on the weekends, whether it's someone coming in seeking treatment, whether it's someone coming in after 30-day inpatient seeking recovery housing, whether it's someone who just wants to volunteer. A lot of people are in recovery houses. We're centrally located. They come to the center. They just want to sweep, clean up, be around other people, like-minded individuals in recovery. So that's very significant to our recovery community and the participants we serve. Alongside with that, Jimmy didn't mention, but just like we also have a transportation program that was funded through the Opioid Abatement Commission. So just if you have that thought of going to treatment and you come in, you're like, hey, I want to go to treatment, we have a ride for you. A barrier that a lot of people don't talk about is the wait or the ride to treatment. So if I come in and I want to go to treatment in London and someone has to come 2 hours to come get me or an hour and a half to come get me, there's a lot of time for me to think about not doing this. You know what I mean? Like, I need to go right now. So having transportation and saying like, hey, you want to go to treatment? We got you a bed. Here goes a ride. That's very significant. So I just want to thank you all for your continued support.
Thank you very much. Any questions or comments?
I want to thank you guys for what you're doing. We're obviously well impressed and very familiar with Voices of Hope. And just to kind of further add to that, I agree wholeheartedly that we need tried and true programs that are evidence-based, that can measure the same outcomes and deliver the same outcomes that we expect in Kentucky. But furthermore, to add to that, if there's innovative programming that can still establish that evidence-based approach and efficacy, I think some of the thing that we've done through the commission here in Kentucky is encourage grassroots organizations to emerge. And what this allows is for some innovative approaches to continue the aftercare support. And so I just want to kind of echo that and kind of add to what you so generously shared. So thank you. Thank you both.
Thank you very much, gentlemen. Next up, Applered Legal Aid, and that would be Mr. Smith.
First off, thank you all for the opportunity to speak today. I'll add that I've been happy to be involved in the commissions and overseeing the work for a while now, from your all's very first public meeting back in Pikeville in, I think, 2022 when you all were doing that, and to watch this organization grow and all the work that you all have funded and also that the commission's own staff have done and you all as the commissioners. It's really been an impressive process. So my name is Evan Smith, and I'm here on behalf of Kentucky Civil Legal Aid Organizations. Like everyone here, I have personal connections to the opioid epidemic that took over my home region around the time that I graduated from Pikeville High in Y2K. And so I want to talk about why providing free legal help is a vital part of our Commonwealth's response to the opioid crisis. From Pikeville to Paducah, we've witnessed firsthand how civil legal services transforms communities and lives. Addiction sets off a domino effect on someone's life, toppling each piece, like their home, health, family, and income, until they are left without hope or support. Civil legal aid can reverse the domino effect, supporting someone's recovery journey and standing a piece of their life back up with each civil legal issue that's resolved. And the need is clear, as you all know. In 2023, 80% of people in recovery had more than one unresolved civil legal issue. Many need help accessing health care or fighting housing insecurity. We regularly advocate for clients denied public benefits like SNAP, KTAP, and Medicaid, for parents working to maintain custody during treatment, and for individuals whose medication-assisted treatment is challenged in court, even when others try to discredit it. We meet people where they are, in jails, treatment centers, and recovery communities, and help them stay on track. Our services are backed by data and driven by compassion. Did you know that the 2 weeks after jail release are the highest risk period for overdose? That's when Matt heard about legal aid during a jail info session. An attorney helped get the documents he'd need to work when released. When Matt left jail, all he had was a trash bag of belongings and our phone number. He feared he'd relapse if he ended up on the street. We helped him find supportive housing. With stability, Matt got a grocery store job, and he's been named Employee of the Month multiple times. Project Renew isn't a one-size-fits-all. It's built on the idea that everyone's recovery journey is different. It helps with the legal and everyday problems that can get in the way of getting better. And it works. A mother in recovery regains custody of her kids. A man with a felony record gets expungement and then his CDL license. A client facing eviction keeps their housing and their sobriety. And many clients pay it forward, working to support others in recovery. Peer involvement improves outcomes and helps people transition more successfully between settings. This isn't just about individuals. It's about rebuilding families, stabilizing communities, and strengthening Kentucky's economy. Every dollar spent on substance use treatment saves $4 in healthcare and $7 in law enforcement. Legal aid then extends those savings by preventing relapse, reducing foster care placements, and helping people return to work. Over 50 studies have been conducted since 2023 on the value of legal aid. The average return is an estimated $7 for every dollar invested in civil legal aid programs. For example, 1 in 5 arrests in Kentucky are drug-related. But it's cheaper to support a mom or dad in recovery than to incarcerate them or place children in state custody. And the return doesn't stop there. When parents get sober and stable, they rejoin the workforce, keep their families together, and give their children a better shot at school and life. That's not just good policy, that's good economics. Legal aid may not be the first solution people think of when it comes to the opioid crisis, but without it, recovery often doesn't stick. People fall back into crisis when they can't get their license reinstated, can't find housing due to an old eviction, or can't see their kids despite being sober for months. Let me leave you with one last story. Laura wanted to escape an abusive relationship, but was told her violent record, tied to her abuser, would prevent her from qualifying for public housing. Her Project Renew attorney filed for expungement. With a clean record, she secured housing and disability benefits. Today, she's sober, safe, and thriving. When you consider the Commission's priorities, I hope you'll remember Matt and Laura and that there are thousands more Kentuckians like them who will have the chance to recover if they have access to civil legal help. We hope you will prioritize solutions that remove barriers to recovery. Thank you very much.
Thank you. Any questions or comments? Thank you very much, sir. Next up, Lane 13 Consulting with Selena Coomer.
Good afternoon, everybody. How are you guys doing today? Thanks for offering your time to listen to us and making this a safe space for us. I greatly appreciate it. And I am super empowered by all the comments before mine. So, my name is Selena Coomer. I'm with Lane 13 Consulting. We are a directly impacted lobbying and consulting firm here in the state of Kentucky. And I'm also a person in long-term recovery, and I just celebrated 17 years sober. And I've spent the last 17 years of my life on the front lines of recovery and reentry. And I would not want to spend my time doing anything else. Thank you for your continued leadership and commitment to addressing the opioid crisis in Kentucky. As you consider how to allocate current and future abatement funds, I urge the Commission to prioritize investments in proven, high-quality providers who are already doing effective work in communities across the Commonwealth. Rather than focusing on launching new initiatives, we must ensure that existing evidence-based programs, particularly those with demonstrated outcomes, are sustained and strengthened. At the same time, it is important to acknowledge that not all service providers operate with the same level of accountability or effectiveness. While many enter this field with good intentions, those intentions do not always translate into positive outcomes. Unfortunately, the presence of low quality or even harmful providers undermines public trust and jeopardizes the well-being of individuals seeking recovery. To address this, I recommend funding comprehensive public education efforts that inform individuals, families, and referring systems about what high-quality treatment, recovery housing, and community support should look like. By equipping people with the knowledge to distinguish between effective and ineffective services, we can shift the focus from quantity to quality and ensure that those impacted by substance use disorders receive the care they deserve. Thank you for your time and consideration.
Thank you. Any questions or comments? Thank you very much. Next up, Volunteers of America, Mr. Hurley. Oh, there. Didn't see you in the back corner there, Mr. Hurley.
Good afternoon, Director Evans, members of the Commission. Thank you for the opportunity to present today. I want to echo a lot of the great points that have been made. I also want to thank you for the confidence that this Commission has shown in Volunteers of America as we address opioid use disorder throughout the Commonwealth. We couldn't do it without your support, and we really appreciate that continued display of confidence. First and foremost, I'd like to ask that we, or that you as the Commission, consider sort of the changing federal funding landscape as we go into this next funding cycle. I think there's a lot of uncertainty, and that's sort of, especially in the nonprofit sector, sort of rattling us all. So I want to commend you all for your continued, I wouldn't say loosening, but expansion of projects that you funded. And I'd like to ask you that you continue that flexibility, obviously within the parameters of the settlement agreements themselves and Chapter 15 of KRS statutes. We recognize the limitations of our reach as a nonprofit. We rely on very strong community partnerships, and I think two examples of that, whether it's interagency or intergovernmental cooperation, are our Family Recovery Court programs, where we actually look at trying to address issues with families in crisis that have become that have come on the radar of the Department of Community-Based Services, as well as Administrative Office of the Courts. And this is a really neat program that's designed to try to disrupt intergenerational cycles of trauma and substance use, and really at the core of the program is protecting children, strengthening families, and then ultimately reuniting families. So I think that's another solid example of that sort of interagency cooperation that we seek to, not only with our governmental partners, but also our nonprofit partners as well. Another, I think, great example of a force multiplying with valued partners is our recovery community centers, something that you all have invested in, and we thank you. We've seen great impacts from our partner agencies that are also running recovery community centers, whether that's Voices of Hope or the Hub. These are just amazing institutions and really the fulcrum of a strong recovery-oriented system of care. This is where folks in all stages of recovery can, access peer support, access different meetings depending on what their needs are. They can access education, employment support, usually provided by our partner organizations. Great plug for Project Renew. They've been excellent partners with us in terms of barrier removal and legal issues. Goodwill as well on the employment side of things. But most importantly, I think what's been sort of alluded to in some of the testimony earlier, these are places where folks can engage in pro-social activities and don't have to worry about the allure of substances. And that what we're seeing at some of our recovery community centers, parents bringing families to a Super Bowl party, sober Super Bowl party, or just really reinforcing that pro family, pro social activity, and we thank you for that continued support. One of the things that we'd also like you all to consider moving forward, again with the issue with federal funding up in the air, is we want to maximize return on investment in terms of these abatement funds, whether it's local or state funds, federal grants, state grants. And so what we're looking at is, or what we'd ask you all to look at is look at statewide or regional nonprofit coalitions. And if in terms of creating continuums of care, and that way where you have multiple providers working together to fill any kind of gap that they might not be able to provide, and making sure, and really what the thought process behind that is trying to get it right as possible on the front end in terms of trying to reduce the need for multiple attempts at treatment. And in terms of that front loading, obviously quality treatment is key, but that also includes back end recovery supports. And so I think that's, if we had like either statewide or regional continuums to help folks move through, I think that would be a very good approach. And so that's one other ask that we have for you all. Finally, don't tell my boss, but I've got the best job in the world. I get to be a cheerleader for a lot of these amazing people behind me, and provide technical assistance to cities and counties through the Recovery Ready Communities program. And one thought that we've had is, it's a pretty intensive program, and folks are, and one of the core components of that program is an asset map, a local asset map of the local recovery ecosystem. And so we were hoping, possibly as a dream, that the commission might explore options in terms of creating like an incentive or gap filling fund in the future. So where the communities are doing this good work and these solid explorations of their systems, that that they might have access to a set aside of dollars for that purpose to fill those gaps. Thank you for your time and your expertise and your commitment to the citizens of the Commonwealth, and we really appreciate all the great work you've done. Happy to entertain any questions.
Thank you. Any questions? Thank you very much, sir. Appreciate it.
Thank you.
Next up from Operation Night, Mr. Varney.
So I said, my name's Carl Varney. I work for Operation Unite. I've been with them for 13 years, and we cover lots of areas. These are my best friends that are sitting behind us, and we do a lot of stuff together. And I was just thinking about, I do not envy any of you and the decisions that you make, and sitting on this council and how heavy this is, deciding, what gets funded and what does not. And then as I was thinking about that, I thought, why are you all here in the first place? And it's because we were lied to, we were targeted, and many of our people were murdered. And so as all of the programs that we've heard about today and the things that are encompassed in this, and all the victims that we see of this crisis that we're still feeling the effects of every single day, through all these different facets of our society and our communities, from people who have lost loved ones, and people who are trying to get into treatment, and some people who are recovered and want to stay in that space, and then some people who are struggling to get there and are just trying to stay alive, and I know lots of those different community members and all of those different areas from but the one I'm here to talk to you about is the ones that I get to work with every day. The victims of the opioid crisis that are fatherless and motherless. Most of what I do is I get to serve in southern and eastern Kentucky, and have branched out throughout the state as well. But I go in and I talk to young people, and we try to give them tools to help them know how to cope, to know how to make, control their emotions and build resilience through the different programs that we do. And really what I get to do is build relationships with them. This year I've been able to speak to more than 14,000 students. And when we do that, we don't just I don't just go and hang out with them for 45 minutes and then leave and go somewhere else. Usually we do those classes and those sessions 30 students at a time. And then I go eat square pizza with them. And then maybe if we're at an elementary school, I get to be the all-time quarterback at recess. Because one of the things that we know is that what these kids desperately need, they are hurting. And when I go to a school, I don't care if it's in Bowling Green or Paducah or if it's in Pikeville. When I ask them, how many of you have somebody in your family that has died, is in jail, or is in active drug addiction right now, almost every single hand goes up. And so what we know, and what I just want the commission to keep in mind, is that our kids are victims of this. And I know you know this. I just want you to know what I'm seeing out there on the front lines and with our boots on the ground. They are desperately needing hope. They need people that will speak into their lives and speak truth to them and build relationships with them. And so those folks that are doing that, I would just ask that the commission would help them. And let's build more of them. And let's train them so that these kids do not have to understand what it's like to lose their own kids one day because of substance use. And so I appreciate you so much, and I just look forward to seeing you and what you all do. And like I said, I don't envy you, but if you got to see what I do, you would envy me. So thank you all.
Thank you. Any questions or comments? All right. Thank you very much, sir.
Yep.
Next up from Eastern Kentucky Concentrated Employment Programs, Director Wilson.
Good afternoon, and I want to thank you for this opportunity for me to speak on the behalf of Eastern Kentucky Concentrated Employment Program. You may think, what is a workforce program doing in reentry and recovery? I'm Jimmy Wilson, and I am a director of our Recovery and Reentry Services. We cover the 23 counties in eastern Kentucky. We do the workforce. We manage several other grants that are for recovery and reentry. And we do have an outstanding track record as for the last 6 years managing several programs and helping many people get back on track. Because we know that employment is the second best thing as far as residential treatment for participants coming out of recovery, reentry, incarceration. But we also, it's a lot of other people have asked today, so I'm going to go ahead and throw it out there. The multi-year grants. We're very thankful for the funding we have received from the Opioid Abatement Commission. That allows us to serve 8 more counties in eastern Kentucky, the most needed counties, to provide workforce services for them. But we would love to have a 2-year grant, 3-year grant. And again, we have that track record of managing those funds effectively, being good steward of funds, and using those funds where we want to have our participants not only, sustain recovery, but have a sustainable wage, a sustainable employment, and that only reflects their family, the family reunification, and as well as the community. My new phrase is, we want to replace recidivism with recovery and reintegration. We want them to be able to reintegrate back into their homes, their families, their communities with good paying jobs. So that's the reason we continue to ask for you to fund these workforce programs. And we try in a lot of innovation programs. We use virtual reality headsets. When people are in recovery, they may be there for 30 days, 6 months. They cannot go out and rediscover themselves or redefine themselves they may have been a nurse. We work with nurses, doctors, lawyers. As we know, it does not discriminate addiction. And we can go in there in these recovery centers. We have job entry retention support specialists, not only throughout the Commonwealth, but throughout eastern Kentucky. And we have them housed in the Kentucky Career Centers where they can get those wraparound services with community action programs, OVR. So we can go into these recovery centers, detention centers, and show them a different path forward. We can let them practice knee surgery on, the VR headsets. We can show them different career paths. And once they do that career exploration, it starts them thinking, okay, I do have an opportunity. I do have a way of life other than what I've been doing the last 10, 15 years. So that's when our job entry retention support specialists can help them build that resume, build that career path, that reentry plan. We want to get them on a career path. We want to give them pathways to different professions, to different careers. We know they need a job. We know they need money to survive, but we don't want that to be the end. We want it to be a sustainable career path. So we are really focusing on work-based learning, work experience, education, training, and again, it goes back to those valued community partners, the collaboration with the KCTCS, the adult ed, to get all those pegs in place. You can't, expect them to be able to go to college. They need their high school diploma. They need we meet them where they're at, and they need their ID. They need their birth certificate. And we start out at those basic needs, and then we build upon that. And at the end, we've had many successes of parents that we work with in drug courts, in recovery centers, detention centers, and they have come in. And I've sat on those drug court teams, and you would think, I don't know if this person's going to make it. And then they end up making it. And then you get them their high school diploma. And then you get them a certification. And it just keeps building after that. It builds their self-confidence. They say, I didn't think I was able to do that. But they did. And we build upon that. So we have our numbers. We have our goals that we have to meet, grant requirements, of course. But the human side You do what's right for people, and they will respond. You build the trust. And at EKSEP, that's what we do. We build that path forward. We give them opportunities otherwise they may not have. And we appreciate your support, and we just want to reiterate continued funding for these workforce programs that work. Thank you.
Thank you. Questions?
Just a quick question.
Uh-huh.
What percentage of your clients are employed, and how long does it take them to get employed upon?
It differs when they're coming out of, if they're we start working with them after 30 days if they're in a recovery center, and then we get them those skills. Okay, we know Johnny's going to need a birth certificate. He's going to need a ID. He's going to need a social, and all those items. Then we start referring to community other resources, because we are a workforce agency. We're not, we don't do mental health, but we have those resources to refer those services out. And then we do virtual interviews. They come into the career center. They've got an appointment before they leave that recovery center, and then we start job searching. So I would say 30 days when they're out of the recovery center, they have some type of employment or they're enrolled in job training. And we have an 80% employment success rate with our participants, not only in Eastern Kentucky, but across the state. And again, it's those support services, it's those wraparound, and that support post-release. We just don't say, okay, go find a job. In the drug courts, there's just so many partners and people that play such a critical role in this. We can't do it alone. We rely on everybody. Apple Red is one of them. I'm from Eastern Kentucky, and I've seen the effects of, the opioid crisis and the unemployment, and I've worked with families, I've worked with kids, I've worked with Head Start, and I think that's such a great thing that we do is the Kentucky Career Centers. If they need that person comes in and needs services, is in recovery, and maybe their child needs Head Start or needs another program, they can get all those services at that place.
Thank you.
Thank you.
Thank you very much. Let's see, one more on our list is QRT Officer Blair.
Good afternoon, Commissioners. My name is Justin Blair, and I serve as the Quick Response Officer for Hardin County. Thank you for giving me the opportunity to speak today on behalf of the Hardin County QRT. I'm grateful for the work this commission is doing to ensure that the opioid abatement settlement funds are directed toward real, measurable, and life-changing solutions across our Commonwealth. Today, I want to tell you why this funding is not only appreciated, but why it's absolutely essential for the work we are doing in Hardin County. The dynamic of Hardin County radically changed seemingly overnight in 2020, which it did for a lot of other counties as well. There were sober living houses popping up by the dozens each month. Unfortunately, most of them did not have the client's best interest in mind. When these individuals had no choice but to leave these houses, most were stuck on the streets with no transportation. And as you can imagine, that did not do us any favors when it comes to stigmas that surround substance use disorder. As of right now, Hardin County has no transportation service, no homeless shelters, or community centers with the capacity to care for these individuals and assist them in making the next step toward their recovery. As many others have already stated, there is very little happening in efforts to engage and educate the youth about substance use disorder, and we will not get ahead of this without focusing on prevention among the youth. Thanks to the funding we will receive from the opioid abatement settlement, our QRT will be able to expand outreach efforts, deepen community partnerships, and increase the number of successful referrals to treatment programs. This funding is allowing us to get the necessary materials to put life-saving supplies in the hands of our community members and is creating more awareness while fighting stigma in our communities. It is creating an avenue for people like myself who have lived experience to meet and walk with individuals on their journey to recovery in a way that no textbook or lecture ever could. It has allowed us to begin putting together a collaborative effort in our community that is and will continue changing lives. However, community change isn't an overnight process. It takes time and consistency to change the way we think about it, talk about it, and address substance use disorder. It takes time to build trust and supporting relationships. This is especially challenging for a community that has never had a program to implement this type of approach. In light of that reality, I would like to suggest considering 2 or even 3 years of support for the programs that have been awarded funding, particularly to those programs like ours that are just getting implemented. This will allow us the time to foster this change and collaboration, as well as allowing us to rest easier knowing that we aren't putting in all of this hard work with the possibility of having to end these efforts due to lack of sustainable funding. I am aware that we must have multiple streams of funding to be sustainable over the long term, and I am doing my best to work toward that. But 12 months is not much time to implement a program like this and acquire sustainable funding at the same time. With your continued support, we are ready to meet that challenge. We don't need miracles, we just need momentum. The funding you've provided is giving us that, and so we're asking you to help us to keep that going. Thank you again for your time and your heart for Kentucky communities. Thank you for believing that every life is worth saving. And thank you for standing with Hardin County as we fight this epidemic with compassion, consistency, and courage. We're not just responding to crises, we're restoring futures. And with your help, we'll keep doing just that. Thank you.
Thank you very much. Any questions or comments? Thank you very much, sir. I just want to remind everybody that there is the opportunity to continue to submit comments through the email address I provided earlier, which is also found on our website, up until June 20th in order to be considered to the July meeting. As for my records, I shows everybody who had submitted a request to speak to the commission prior. Is there any organization present that did submit that I've missed or haven't reached out to? Thank you very much. I want to make sure we didn't miss anybody. I also want to make sure for the record reflects that Treasurer Metcalf and Secretary Friedlander have been with us through this time frame. So thank you very much, both of you. To all of you, before I move into the next phrase, I do want to thank you for coming and sharing with us. I want you to be clear and have a clear understanding that the people here have a deep desire to continue to improve the work that we do. We want to make sure that what we do matters to the Commonwealth and to the people. So hearing from you and hearing the opportunities and the things that you see from being on the ground is something we can't get any other way. So thank you very much for your time and for coming today to present to us. It's very helpful and we're appreciative of the time that you commit today. So thank you very much for that. With that, I'll open up to commission members for any other announcements that they may have or want to make to the group.
Yeah, I got a couple things, Chris. A number of you have mentioned Governor Beshear's announcement of a more than 30% reduction in fatal overdoses in 2024. All of you all own a piece of that, and I want to thank you for it. That this work has not happened in a vacuum. It has happened all across this Commonwealth. Advocates and prevention folks and treatment and providers, just the list goes on and on. Everybody owns a piece of this that works in this field, so thank you for that. I was sad to learn that my friend Eric Friedlander is going to leave state government. We're losing a superstar in state government, and we're going to miss you, Eric. You've been an advocate for people that needed advocacy for as long as I've known you, and appreciate that. I've enjoyed working with you. I've introduced Eric a number of times, and I always introduce him as the smartest man in state government. So I don't know who I'm going to bestow that on, but I'm looking at Dr. Brenzel. I'm thinking maybe that'll be next. But thank you all for coming, and we believe in the same things you do, and hopefully we continue to work our working relationship. I've learned from each of you over the years, and hope to continue to do that. Thank you, Chris.
No, and I think I can't let it go for those of you who don't know me but understand that arriving in this position, the role of Secretary Friedlander and the guidance and the work that he has done that you don't see, I can honestly say this Commonwealth is much better because of him and the work that he's done, and it would be a shame for me not to make sure that that's clear and that's that everybody understands that and put that on the record. It has been a pleasure, and you have been a boon to this commission and to the people of the Commonwealth, so thank you very much.
May I add to that, please? I first got to know Eric when I was a county attorney, and he was heading up the child support effort here in the state. A lot of child support was collected by the division under your leadership, and you were always responsive to the interests and the needs of county attorneys, and we appreciated that very much. And your efforts at the cabinet level have gone noticed and appreciated by all of us who followed your work and appreciate your efforts. So as you leave state government, I'll say give you the Army farewell, which is Godspeed, and good luck in everything.
And Commissioner Raines, I believe you were wanting to weigh in.
I would like to address all the presenters. Is that possible?
Yes, go ahead.
There were so many good things that you all said, and I was taking notes but I did see a common purpose and driven factors such as positive thinking. All of you all had the camaraderie, working together, personal experience, being recovering addicts. The suggestion, many of you all were saying, could we make a suggestion? And some of them was improving funding. And one thing I would say to you is a group like the Voices of Hope talked about it being data-driven, having a lot of information and sharing your successes. Another lady mentioned educating others about opportunities. I was very surprised when I started this last year, about the legal aid and how that was so vital for recovery. Educating the students. Being a former teacher, I totally agree. And I got a big kick out of the guy who said the square pizzas, because we've all been there with square pizzas. The kids are the victims. You are so true. And that is why you're here. You see the repercussions, or you have felt the repercussions. Someone mentioned about the virtual goggles, the lady, and I never thought about that, because when you're in treatment, it is boring. And if you're over 18, you can walk right out. So you're trying to make it as comfortable for that individual. Being from a family who lost a son, I've heard all the opinions about treatment centers, recovery, and many of you all addressed a lot of things that he mentioned many times, good and bad. And I just want to thank you all for all the work you do, because from the families, you don't know how much you are appreciated. You are so appreciated, your time. And when it's getting tough, and as the lady said from the Girl Scouts about the faces that are gray, that is so true. Because you're just walking around thinking to yourself, what can I do? And it feels so dead. You feel like there's no life in your body to fight anymore. So you provide the light, and we really appreciate it. And the commission listens and hears everything you say. I know, working with these ladies and gentlemen, they all have that true love and passion that you do. That's it.
Thank you.
Well, I'm sad to hear. I just found out my friend's leaving. Just want to wish you the best, sir. Appreciate your many years of service to the Commonwealth. You've got a great hairstyle too, but I always appreciated you in the prevention subcommittee, and when you would talk, I would listen. So I appreciate you helping me understand things that maybe I didn't understand before you walked in the room. So I wish you nothing but the best. God bless you, sir.
Secretary Freelander, thank you so much. I appreciate you and will miss you as well. I also want to say to everyone who came out this afternoon, thank you for being here. We are indeed listening and hearing what you're telling us, and we will remember that as we go into the next season of applications. So thank you for all you do in advance for making this Commonwealth a stronger community for all. So thank you all.
That being all of the business for today,
Can I have an opportunity for a
absolutely.
rebuttal?
I was gonna say that. There we almost. Well, I was gonna give you the room. Yep.
No, I want to thank you all. I appreciate everybody listening, right, as we move through this and learning together, which is what we've done, which is what we're supposed to do, right? We don't get stuff right out of the box ever, right? So we have to learn together. We have to learn with you all. You know, some of the most important work I do is just getting out of the way of your all's good idea and your all's good energy. And it does take all of us. You know, we were there was we are the victims of predators, right? We are the victims of trauma. And it takes all of us getting out of our agendas, getting out of our way to make sure that we're able to support you in the best way we can so you can support the folks to get back to recovery, right? What's the one thing, reason Narcan's so important? You're not going to get to recovery if you're dead. So it's up to us to make sure that we keep people here, alive, absolutely prevention, but making sure people can get to recovery. And thank you all for doing that every day.
And with that, I was going to ask Secretary Friedlander, would you give us a motion to adjourn for this? May I have a second?
Second.
Any discussion? All in favor? Aye.
Aye.
And with that, the motion passes and we are closed. Thank you very much, everyone.